Well with Joy. I'm Joy Haith, the CEO for AgeSmart Community Resources. So we're so excited here today because we have Tim Eckels with us, and he's going to share a little bit of information about the healthcare marketplace. We've seen so many people retire early since we've had the pandemic, and a lot of people are retiring without pensions and without healthcare, and he might be able to share some solutions with you today. So, hi Tim.
Hey, glad to be here.
Yeah, before we get started, so Tim found us. Tell us a little bit about how we started our relationship with AgeSmart and you.
Sure, I was interested in being a volunteer to help people sign up for the health insurance marketplace. So I gave you a call and said, can I come in and talk to you? And you didn't have that service in place yet, but as we talked, you decided it would be a good one to add. So I went ahead and got my training to be a certified application counselor for the healthcare marketplace, and that's what I'm doing.
And before that, we really had one number that everybody was sending people to. So now we have this great resource here. Besides our senior health insurance counselors, Tim can help people that are younger than people who are eligible for Medicare. So tell us a little bit of what is the marketplace?
Sure, the health insurance marketplace is an online resource where people can go and pick among multiple health plans and get health insurance coverage. The great thing about it is that the health plans are subsidized for many low-income and moderate-income families. Sometimes the premiums can be low as $10 to $20 per month, maybe $100, and even moderate-income families get a partial subsidy for their premium. The marketplace was set up by the Affordable Care Act 10 years ago, and it's a great resource for people who don't have access to other affordable health insurance.
It can be pretty devastating, and we do see people who don't have coverage and end up in the hospital with a lot of different complications and no way to pay for them because it is expensive if you have no coverage. So we help people through those types of things, but having this in place and planning ahead and really making sure that you have this kind of coverage if you're under 65 is
Right.
great. So who's eligible for the marketplace?
Well, like you said, it's for people who are under 65. They are people, individuals and families that don't have an offer from their employer for affordable and adequate health insurance. It can also be for people who are no longer working, like early retirees or who are unemployed. Those people can sign up for the marketplace. And the great thing is that they can't be turned down by the insurance companies because they have a pre-existing condition. Not only that, but the premium that they're charged will be the same regardless of their health status. That didn't exist before the Affordable Care Act, so it really is good for people to explore this option when they need some coverage and they can't get it through their employer.
Oh, that is wonderful. So Tim, how does somebody apply for the healthcare marketplace?
Well, there's a number of ways to do it. You can go to Healthcare.gov online, and that has a very clear way of walking through the process to get signed up and to pick among the health plans. Also, you can call the phone number at Healthcare.gov, and an agent there can help you get enrolled. But we offer that service here now, helping people with that process, and we'd be happy to help anyone who would like to get signed up, and we can walk them through the process on the computer and help them pick among the different health plans, but also explore just what those premium amounts will be once they get that subsidy. And also, for some people, there can be a subsidy or help with paying their out-of-pocket costs as well. So we can help people with all of that and help get them signed up here at AgeSmart.
So it's insurance, and sometimes insurance is very complicated, and so to have somebody talk through it, and even with Part D plans and assisting folks with those seems simple, but it's like I always would have to go to that senior health insurance counselor to say, explain this to me.
Right.
It looks good, but
Right.
is it really good?
Right.
So that's great to have you here and that you can help. So can you explain the difference between you as an assister and agents and brokers?
Sure. Agents and brokers are people who are licensed by the state of Illinois and who make their living by helping people get signed up for health insurance. The way that they're compensated is that they receive a commission from insurance companies. Now, many of them are trained to help people get signed up on the marketplace, so they are an option for choosing your plan and getting signed up. An assister, on the other hand, usually works for a nonprofit organization like AgeSmart or as a volunteer at a place like this. And we are trained to be objective. We must be unbiased in how it is that we present the plans to our clients and help them pick which plan they would like to have. Assisters have no financial interest at all in which plan is chosen.
So we're so glad to have you here as a volunteer helping people with these decisions. That's great. So what are the steps if somebody wants to enroll in a plan?
Well, what you need to do is make sure you have your information available on your income level, what your income is, and then you would walk through the steps on the health insurance marketplace to determine what your premium help amount would be, your financial help would be. And then from there, you would be able to see an array of health insurance plans where you can pick which one you want. Now, the amount they charge, the amount that any plan charges, will not vary depending on a person's health status. The only way a premium will vary is if you're a smoker and depending on where you live. Otherwise, you will be charged the same amount as anybody else that's signing up for that health plan. But again, we can help with that process, the steps of getting enrolled, and we'd be happy to do that.
Oh, that's great. That is great. So, questions about, can you change your coverage in these plans throughout the year, or is it similar to an employer-based coverage?
Well, there is only one time during the year called open enrollment where anybody can change their plan, and that's between November 1st and January 15th. So we're in that period right now. However, there are other circumstances where you can change your plan or sign up for a plan during the year. They're called special life circumstances, and it's things like if you lose your job, change your job, leave your job, get married, move to another location. There are certain events that allow you to go ahead and either change or sign up for a health plan. But the best thing to do is to do that during that open enrollment period between November 1st and January 15th.
So we are right in the moment. Those are the deadlines we need to worry about, right?
Absolutely. If anybody's interested, come on in before January 15th and we'll help you out.
So even during the holidays, Tim's going to be here helping everyone. So we appreciate you taking and carving out time for folks. I do have one last question. So if marketplace coverage and you turn 65, what happens then if you have marketplace coverage? So say I applied for the marketplace and then I finally turned 65, what happens to my marketplace and Medicare?
It's a great question. First of all, you're not allowed to be both on Medicare and in the marketplace. So generally, for most people, there's a few rare exceptions, but for most people, once you reach age 65, you need to shift over to Medicare and then drop your marketplace plan. Now, if you're low or moderate income family, the counselors here can help you with that kind of special financial help with Medicare, just in the same way that it was available back in the marketplace. It's just that it's a different structure, so we need to help you through that process as you get signed up for Medicare.
Right. And I'm so proud of our senior health insurance counselors who also help with benefits assistance, but last year alone, just the folks here helped people save $2.7 million. So don't think that you have to pay an enormous amount for things. It's not inexpensive, but we can help you reduce your costs. So, but Tim, thank you. Thanks for helping us out with this, making sure that there's not just one number we can call now. They can call AgeSmart and get help with the marketplace. Is there anything else that you'd like to mention to folks?
No, just to encourage people to give this a try if they need the coverage and to let their friends know about it.
Great. Thanks again. Thanks, everyone.